So good evening, everyone. Because Yoni has so graciously agreed to present tonight, I'll be your host. So I'm Chantel, for those of you who don't know me. So tonight we're lucky enough to have Yoni Nazarathy present his paper entitled, well, his work with a number of colleagues entitled Safe Blues, a method for estimation and control in the fight against COVID-19. So I think most of you will know Yoni. He's a senior lecturer and associate professor in the School of Math and Physics at the University of Queensland. And when he's not doing that, he's contributing to his EdTech startup, One on Epsilon. He's also, I think, pretty much a specialist in Julia, the language. So, and the goal tonight is to finish in about 30 minutes, and then we're going to have a bit of a longer discussion than usual. So over to you, Yoni.
All right. Thanks a lot, Chantel. And thanks, Chantel, for taking this pandemic seminar that we started, I don't know, 6 weeks ago, maybe, and making something really nice of it with all the online presence and all that. So thanks for the co-organization. All right. So this is Safe Blues. This is something that colleagues and I started working on just maybe 2 months ago. For the first while, we just wanted to kind of see, what can we do to help with COVID in general. We didn't want to add too much noise to the system because so much is already done around COVID, and so many people have been involved. So we didn't want to kind of do stuff that will be useless. So we spent about a week or two triaging problems and things we can work on. The first week and a half or so, we were actually focused on something completely different. It has to do with convalescent serum, so blood transfusions, and we just thought that there are a lot of operational problems associated with that. So if that method ever picks up, meaning taking blood transfusions from people that are that have recovered and putting that blood in sick people, that there would be stuff to do with that. But then quite quickly we came onto this idea, Safe Blues. And yeah, so this is with Raj and Chris from MIT, and Shane Henderson. He's a senior figure in applied probability in Cornell. And many of you would know Professor Peter Taylor from Melbourne. And of course, Sarat and Marine are at UQ. And Apli Vornin, I'm sure there are people here that know Apli. So he's graduated from UQ a few years ago, then did a master's in Melbourne. And if there are no surprises, he should be in Columbia University by the American fall. So you could go to safeblues.org and see the paper and a bit of social media in general. Perhaps this presentation will be there as well. Okay, so here's kind of the thing. Well, I mean, COVID is all about measurements, and you want to be able to measure it. Otherwise, you can't really do much. I mean, we're talking about the analytical aspect of COVID, where clearly has been spoken here in the seminar before. Mathematicians, physicists, epidemiologists obviously are advising government. And there are a lot of dashboards, but dashboards are great, but often, as has been spoken here before, they're based on measurements that are only partial. So there's a lot of lack of information. And that's due to the that's due to the nature of the disease, and to the fact that there's a long gestation period, and just to the fact that not everybody's tested all of the time. So, the first questions that we were all dealing with here around February, March is, well, how do we stop this thing from overwhelming the medical system? And in some countries, it didn't, like here in Australia, but in other places, it certainly did, and still does, as is in many places in Europe and the United States and elsewhere. And there's even after you finish the first wave, there's still lurking dangers. So leaders, as are here in Australia, but also elsewhere in the world, are grappling with the decision and the questions, well, what are we going to do to release social distance measures? And the only sensible way to do that is pretty much to release slowly, see what's happening, wait 2 or 3 weeks, measure, then update, wait a few more weeks and update further and further, etc. So the Safe Blues idea, if implemented, it's currently not implemented for COVID nor for anything else in any place, but if implemented, can perhaps obtain measurements starting from now. And in countries where there's still quite a major wave, it can then give kind of real-time estimation and update information in around July, August, September, etc. And that can help governments refine their social distancing measures in an online manner. That's kind of the general thing. Well, what affects a virus? I mean, we've spoken a lot about the basic reproduction number, R0. In the paper, we actually call it R effective, the effective R at any time T. But that's the number of individuals that any infected individual infects. So what is R0 a function of, kind of in general terms? Well, it's first of all a function of the biology. That's a biology of both the pathogen and the host. And it's a function of the environment, the weather, perhaps of other things. We're not sure how weather exactly affects COVID-19, but it's most probably some function of that. It's certainly a function of the conduct. That's hand washing, handshaking, using face masks or not, and other aspects of conduct. But notably, it's a function of contact. So social distancing is clearly all about reducing contact, right? I mean, that's what social distancing does, reduces contact. It also harms economies and has other social impacts, but that's what social distancing does. So the social distancing is a method to reduce the contact, and through that to effectively reduce R0, where in Australia clearly R0 has gone way below 1. Pretty much everybody believes that, and the epidemic is quickly dissipating, and probably in other countries in Europe as well. So it's very easy to turn contact off fully. But when we're then going to adjust contact and kind of turn things on and off and on and off and on and off, then it's not really as clear how R0 is affected by contact. And that in fact implies that it's not clear how the epidemic progresses as a function of social distancing and contact. So what if we had 2 types of viruses? So, you've got COVID on the left, let's call this R01, and that has that function superscript 1, and it's a function of biology superscript 1. And on the right-hand side, you have R02, and that's a function of biology 2, and it's a different function, okay? So social distancing will still affect both contacts together. I don't know if anybody from this group has got a cold in the past month or 2. I mean, social distancing has affected colds, other common colds, just like it did for COVID. So that's kind of obvious. So Safe Blues is about replacing this right-hand virus, which is kind of a second virus, with many virtual safe viruses. So these are these R01, R02 up to R0N. So what we plan to do is safely, in a privacy-preserving manner, inject a variety of safe blue strands. Each is its own kind of quasi-virus or virtual safe virus or token passing mechanism. I'll explain how that works in a second. And they're all different from COVID. I mean, we're not simulating COVID exactly, but they're still affected by contact in a somewhat similar way to what COVID is infected. So as you can see, there's on the left-hand side, you have your biology of superscript C, that's COVID now. And on the right-hand side, you don't have biology, but you have Bluetoothology. That's not really a word, by the way. So the Bluetoothology of the first strand of COVID, the Bluetoothology of the second strand of COVID, up to the Bluetoothology of the nth strand of COVID, the nth strand. And all of these safe viruses are affected by COVID in the same way. Now, the difference is on the left-hand side, you can actually measure. You can look at, sorry, on the left-hand side, you cannot measure. I mean, you can't really measure, certainly not in real time, what's happening with COVID. You get some retrospective information. But on the right-hand side, since Safe Blues is an artificial injection of something that's constructed by us, then you can actually get real-time, immediate measurements of what's happening with those Safe Blue strands. So you can see the number of susceptible, infected, recovered, the number of latent as well. And from that, you can extrapolate information about Safe Blues. But maybe all those functions on the right-hand side, F superscript 1, F superscript 2, up to F superscript n, are related to F superscript c. And you find that relationship through machine learning, and then you can do some estimation for the current state of COVID. That's kind of the general idea. So this is how it is from a technical perspective. So on the right-hand side of the slide, you have a bunch of tables. I'll briefly explain what they are very shortly. But what you see on the left-hand side is you see some kind of population of people. And some of them are red, some of them are green. So the red have COVID, but we actually don't know this with Safe Blues. It has nothing to do with what people have COVID or not. And some of them are holding cellular devices and some of them are not. Holding a device means that they're actually participating in Safe Blues. Not everybody would participate in the Safe Blues mechanism. And then the server, in this case, injects two Safe Blue strands. We call them strand 1 and strand 2 in this case, the blue and the purple. And by injecting them, some of the people get infected. And then the virtual safe epidemic spreads through the population with reporting back to the server. So a Safe Blue strand is parameterized by all kinds of things, such as when it starts and when it's supposed to expire, and also the seeding probability, which effectively determines how many people the strand is going to affect when it's first kind of put into the population. And then this thing which we call here the infection probability map, you see that on the table on the right-hand side. So infection of a strand is in a sense a function of the mean distance spent during an interaction between two people and the mean duration of the distance, and that will kind of imply the infection. Kind of like a physical virus, but not trying to mimic it fully. And there's also an incubation period and of course a duration period. So then all these people report their Safe Blue strands directly back to the server, and that gives kind of a live information map of what's happening in terms of Safe Blues. Now the communication is called Safe Blues because Bluetooth just like contact tracing, but Safe Blues is not contact tracing. Okay, so here is some table. Perhaps it's partial already because it keeps being adapted all the time. These are some of the contact tracing apps that exist. Many of us in Australia, or all of us probably have heard about COVID Safe, but other countries have contact tracing apps. The Singaporeans were really the leaders of this. Contact tracing is about finding individuals, finding who has been in contact with somebody that has later retrospectively known to have the virus. Okay, so contact tracing is about locating identity of people. Safe Blues is just about, if you look at the table on the middle, table 3 on the right, it's just about the total information of kind of how many people are infected with each Safe Blue strand. So there's no need to know location or identity or who you really are. Okay. So Safe Blues in a sense is a competing concept to contact tracing, but it can also be piggybacked on top of contact tracing because contact tracing apps already have the Bluetooth communication systems built in. Okay, so that's kind of how Safe Blues may live with contact tracing. So let's kind of see on a somewhat hypothetical situation how this thing might work. Okay, so you know what, up to now, are there any kind of key questions or questions at all?
Yoni.
Yeah.
It's Ruth.
Hey, Ruth.
Hi. I wonder if your Bluetoothology is not confounded at the community level by conduct and environment, because, you know, when we talk about things like, when you talk about things like mask wearing or hand washing, that's very much community level behavior. And environment, when you talk about like high density versus low density, again, very community dependent. And so I just wonder, when you put these streams out, are they confounding factors because they kind of obfuscate exactly what the biology of the disease is?
So look, I mean, Safe Blues cannot mimic the biology and is not even really trying to do that. It's just trying to get a signal based on the contact. Okay, so in a sense, those things that you see on your right-hand side, you know, their Bluetoothology is quite different from the biology of COVID, and you know, they're not taking environment or conduct into account. You know, handshaking, masks, etc., are completely not there. But you're then, in a sense, you can solve an inverse problem and learn about how contact has been affected via social distancing, and then use that to infer something about the contact that affects COVID. So no, it's not a. I hope I'm answering you. It's not a true simulation of COVID. This is not a modeling exercise.
No, I mean, I think it's a great model. I also hope, you know, if governments adopt this, that they will understand that each community, even within Australia, will have a different expression because it relies on the environment and the conduct as well as the biology.
Yeah, so I mean, I think kind of in a non-privacy preserving solution, there could have been kind of a lot of local information, specific, you know, locale, age, etc. A whole bunch of kind of information in there, but we've tried to go also for a very kind of privacy preserving solution. So at best, it will be the major city you're in or the state, and not more. But if there would have been much more kind of local information, then there'd be room for local also being the type of subcommunity that you're part of based on your age and other interests. Then, you know, there could be kind of more information, but it's not something we see as possible immediately. All right. Did Zoltan? Yeah, go, sorry.
Yeah, I was just going to point out Zoltan.
Go for it, Zoltan.
Okay, so Yoni, can you say something about what is the difference between these different strands? What would be the difference in their behavior? How easily they spread? Or
yeah, sure. So the kind of the most critical thing is, if you look, I made it a bit small, but if you look at the right hand side of the screen, you'll see on the top right table 2, you'll see the 3 bottom parameters: I of D and tau, and Fi and Fr. So most importantly is I of D of tau, which is infection probability map, which is really the probability of infection when you're meeting, and that can be refined based on distance and exposure of time. Okay, so how infective is a strand? In fact, in our simulations, that's the only thing we varied, really. But, you know, you can also speak about the incubation period distribution and the infectious period distribution.
Okay, so then the question is, so 2 things. So one is, in principle, you could just collect the statistics of the pairwise meetings and run any kind of parameter simulations after the fact using that data that was collected, without actually implementing this live, right? You just store which strand met which strand, and
you mean which individual met which individual? Yeah, if you don't care for privacy at all.
No, that would be anonymous. The strands just have a number, so it's not attached to a person. You just collect the how frequently and who contacts who. And then you could run all this in the background after you collected the data. So that's one question. So but maybe the data would be too much, I don't know. So the other thing is, so even if you add these different parameter distributions, so how would that help you to extract more information about the real disease? Having different incubation, having a parameter distribution of the incubation period, or
No problem. So for the second question, I'll answer shortly, if you don't mind. When I'll just refer to your question when I get to kind of the, you know, the kind of machine learning methods. But the first question is, yeah, I believe that in principle you can do this. But I must even say that even with our current solution, which on a first read seems to be extremely privacy preserving, privacy experts are already seeing loopholes, because, you know, you can sometimes de-identify people just based on the type of strands which they have, etc. So it might be just an implementation issue of you know, what you compute online, what you compute offline. We just went for a kind of a very simple protocol specification. We have a full protocol specification, and even with enough time, we might even implement it if nobody implements it before us. Yeah, I'll get to your second question in a few minutes, okay?
Yeah, so I understand. So the idea is that the more you aggregate the data and less individualized, then it's less suspicion that it could be some traces of privacy issues left.
Yeah, indeed. So table 3, which you see in the middle, these are just kind of taken directly from the paper. This is an appendix of the paper. So all that an individual reports on, say, a daily basis is the current incubating strands, how many strands an individual has, or the ID numbers, the strand ID of the strands which are incubating, how many she's infected with, and how many she's already been removed from. That's all. So it's kind of very, you just send this information up to the server.
Okay, thanks.
Okay, wait, and Jan Molter, go for it. Jan, you raised a hand.
Yes, hi Yoni. With the tracing apps, people sort of discussing the amount of people in the population who have to like participate in the system. So how is that with Safe Blues? Do you also need a threshold participation rate, or is this like the data you collect valuable in any case?
Yeah, great question. So I mean, with contact tracing apps, the benefit which you get from the app kind of grows linearly with the complement of how many people are using it. So you know, if you only have 10% of the people using the app, and you're walking around and then you're infected with COVID, then, you know, only 1 of 10 people you'll be able to quote save, right? Because the contact tracing authority will find them. I mean, in general, contact tracing, just so we're clear about contact tracing is only for the end game of the disease, really the end game where we're hopefully at in Australia, but, you know, Europe is still not there, right? And certainly not the United States. So with contact tracing, you know, it can be useful if not many people use it, but it's only useful proportional to the number of people that use it. With Safe Blues, and I'll get to this just a bit more when you see some of the kind of analytical demonstrations, or at least simulation demonstrations, then you need to treat the penetration proportion of Safe Blues as kind of your indication of sample size. So we believe that Safe Blues can give value to a country or a state with even if we're between 5 or 10% penetration, okay, where people would give up on contact tracing right there. Because if you take 5 or 10% of the population, then, you know, it means that 1 in 20 or 1 in 10 people interact with this thing, and you're getting kind of a good enough sample for the movements of people. So it's discussed also in the paper, but yeah, it's important.
Okay, thank you.
Sure.
Could I maybe make a comment about the contact tracing as well?
Sure. Who's speaking? Sorry.
We think back, Nathan.
Hi, Nathan.
If we think back to the last talk that we had, there were these super spreaders. And I guess one thing that comes to mind with contact tracing is, even if you had, say, 80% coverage, if one of the 20% who weren't covered was one of these super spreaders, then you'd have to wait something like 14 days before anyone actually notices that there could be problems.
Right.
Then you've got another 14 days where you need to wait before you can realize the people in the 80% who've been spreading it. And that kind of means that in some cases, contact tracing may be not as good as we might think.
Yeah, I mean, super spreaders, that was really interesting last week, what was raised. I mean, they raise a whole nother issue, but in a sense, I believe they can also skew Safe Blues measurements off, because, you know, it depends if a super spreader is really due to biology or due to contact, right? But you know, you might have super spreaders that don't participate in Safe Blues, or if there's some bias, and then we might have a similar bias. But yeah, thanks for that. Okay, so I'll get back to this. So now here's a course of a fictitious epidemic. Okay, so it's run for just under 100 days. There are 5,000 people in this epidemic. It's clearly not realistic. I'll explain this model a bit more later. Proportion infected is kind of realistic. So you start at just 1% in a quarter infected. These are these red points. And the epidemic grows in the first couple of days, and around day 15 or so, social distancing is turned on. The epidemic dissipates, and we're at day 99, and social distancing is about to be turned off. Now, in this fictitious epidemic, Safe Blues are introduced from the start, and they're introduced at a penetration proportion of 20%, and there are 50 Safe Blue strands. And the infectivity of the strands is taken to be at roughly the infectivity of the actual COVID, okay, when no social distancing is taking place, divided by the penetration proportion. So it's 5 times as more infective. Now, in practice, we won't know the actual infectivity of COVID, but we kind of have a bit of a range. And in general, we just want to put these Safe Blue strands to cover the spectrum. Now, I need to say here that to the defense of Safe Blues, what you see in this simulation, since there are only 5,000 individuals and only 1,000 with Safe Blues, the Safe Blue strands are more noisy than what they would be if you would just scale everything up by 1,000. We just, on this model, we didn't run such a simulation. Okay, so you got all these strands that are behaving in a completely different manner, each one individually, to the actual epidemic, but as you can see, that they're following a somewhat similar trend. And then comes day 100, and you're about to turn social distancing off, and you did. You say, good. You know, this is like Georgia. Everybody can go. Georgia in the United States, everybody can go bowling now. And then 2 weeks pass, but in these 2 weeks, you don't really know what happened with COVID. Okay, you have no idea. I mean, you really cannot tell what happened with COVID. So you're at day 115, about 2 weeks later, but what you see on these Safe Blue strands is that there was immediately an increase. And I mean, if Safe Blues was running this weekend in Australia, we'd also immediately see an increase because, you know, we were all out and about and doing more things. So even if we're not speaking about estimation or prediction, this already, by the way, gives something. So if this picture would be averaged and presented on a dashboard, even though I bashed dashboards in the second slide of this presentation, to the government immediately kind of sees some sort of nominal measure of what's happening in terms of contact. It can at least quantify that. Okay. But you can do more. So if we now look at these 100 days, and we treat these first 100 days as a training data, and your independent variables are the blue COVID safe strands, as like your X's, and your dependent, the blue Safe Blue strands, and your dependent variable are the Y's, yeah, the actual epidemic. Then what we can try and do is try and build a predictive model based on the first 100 days for the epidemic based on the Safe Blues. And then we do have these 2 additional weeks of Safe Blues predictions. And if we see what our model predicts, well, this is what it does. So Safe Blues will give you a prediction in these 2 weeks and say, okay, the epidemic has increased like that. Now, let me put a little disclaimer here. I mentioned Australia. I don't think that this situation is relevant for Australia. So I'm not saying that we could have used here this weekend in Queensland when we opened everything and we could all go hiking or partying or whatever, that we could have introduced Safe Blues and gotten information, because we never had such a big peak in Queensland anyway. But if you're looking at places in Europe or the United States and you put yourself in this kind of day 100 situation, then yes, you would have had a good training period. Then 2 weeks pass, and look, the actual epidemic was actually very well predicted in the short term via Safe Blues. So that blue prediction has now become green, just so we see what the projection was, and the situation continues and we can continue predicting. So that's kind of the short-term prediction that Safe Blues can do. And again, it's important that each of the, you keep in mind that each of these Safe Blue strands, you know, was not actually trying to be exactly like a COVID. But this is kind of the slide to keep in mind, and they all behaved according to contact in a similar way to COVID. And then machine learning can, which is just basic statistics in a sense, can help do that. So I'll explain how that happens just a bit further down. Okay. So what are the type of estimation and control problems that we wish to handle with Safe Blues? But just before I say that, I say estimation control, but we actually believe that even if you don't do any estimation and control, Safe Blues can still give a pretty good indication to government about immediate contact that it currently does not have. At the moment, it's trying to fly an airplane, or governments are trying to fly airplanes without any sensors, and adding things like Safe Blues can be sensors of that type. Aaron, you had a question? Hi, Aaron.
Hey, Yoni. Yeah, thanks. I was just wondering, so on that previous slide you showed, do you think that even say you had like one city or state that did implement Safe Blues, could that model then be transferable perhaps to different cities with similar demographics? So you could be using sort of the aggregated data that you're getting about training this prediction to sort of predict in other cities, not just the city where Safe Blues is actually implemented?
Yeah, I think it's a great question, and yeah, I'm sure it can, because I mean, at the moment, actually, many people are trying to do this exact thing using a variety of things. So I've had somebody send me Facebook data, right, and you know, just kind of movement data, and people are dealing with network data. So Finnish colleagues that we've spoken with, working in network science, have gotten network data from network providers of mobility. And there's, you know, if you look at all the agent-based simulations such as that led to things such as the Ferguson paper, the famous Ferguson paper that was spoken about here before, and you know, that was published in March. It's all about kind of more aggregate movement data. So the more kind of live movement data that you get, the more signals you can put in. And at the moment, such data is not present, so people are looking for all kinds of proxies. So yeah, I do believe that even if it's, say, I mean, take a situation where, say, Safe Blues is implemented in, you know, in Norway, but not in Finland, then I still believe that the information collected in Norway could be useful for me.
Yeah, cool, thanks.
Thanks. All right, so what, I mean, ideally, what kind of estimation and control would we like to be with Safe Blues? And these goals are perhaps a bit ambitious, the 7 that you're seeing here. We've only touched in this kind of quick paper that we put out with on the first 2, just to kind of show that proof of concept can be proof of concept. So early warning of a rise towards the second wave. I'll show a quick demo of that. But more importantly is number 2. Understanding the effect of various social distancing regimes on R effective T. R effective T is just a fancy name for R0. It's R0 that's effective at a given time T. Okay. So number 2, people are doing all kinds of complicated studies to understand that, but it's hard to do anything that has to do with mobility, because all the mobility patterns are new. Everything is new. Of course, number 3, designing optimal control policies for fine-tuning social distancing, then that's where a tool that gives government kind of a bit of a finer view can be important, especially if each government will kind of have its own, you know, various levels of social distancing, and the public will know that it's kind of being turned on, made more stringent, less stringent, on, off, on, off, on, off. So with this kind of control, getting live information from Safe Blues can help. 4 is a bit harder, projecting the course of the epidemic in the medium and long run, but still it gives more information. And 5 is even harder. I mean, 5 is perhaps the most heavily discussed problem also in the mailing list of this group, the proportion of asymptomatic carriers. But still, with Safe Blues, you're getting more signals, so you actually know some more things, and you might be able to do more interesting statistics. Uncertainty bounds at 6, that's always interesting and always important. For example, just getting an uncertainty bound to this prediction, something which we didn't do. But in a sense, you almost get this from the safe blue strands just by looking at the strands, because if you would have injected more strands, and say if you put strands in that are exactly identical, okay, so if you make strands, multiple strands that are exactly identical, what you're doing is you're kind of running multiple simulation traces of the exact same thing on the population. Okay, so it kind of comes almost as a gift. And then if such a thing was to be implemented, then it's not like this toy simulation where at day 0 you implement safe blues, but you rather need to inject strands on the run. And you don't want to have an infinite number of strands. You don't want to have too many, just because of the technical constraints of actually transmitting strands between Bluetooth devices, but also due to privacy issues, because too many strands can really de-identify individuals. So how to actually, 7 is how to actually choose the strands. Okay. So what did we do? I mean, we had this idea. We said, okay, let's put it out and let's get some discussion. And for this, we created 3 models for basic evaluation of safe blues. Now, and this is kind of model 1, model 2, and the third one's called model 3. I'll explain it very briefly. They're not the key point. So important, safe blues is not about model fitting. So each of these models is not trying to be a model of reality in a certain country or a certain place, but each of these models rather tries to capture both social interaction, the spread of COVID, and in parallel, the spread of safe blues. And you can call them as follows. Model 1 is Marine's model. Model 2 is Yoni's model. Model 3 is Sarat's model. Each of us worked on a different model and then we compared. It was kind of fun. So Marine's model, model 1 on the left, extremely simple. So you just have these N individuals, no location, nothing. So just think of them as sitting in a circle. And each day, each individual invites a random number of other individuals for a cup of coffee or whatever. So you see the green individual invites these 4 other individuals, and the orange individual invites 3 individuals. Okay, and each individual might invite a random number of individuals, often 0. And that means that they make contact, and due to that contact, there can be spread of COVID if an individual is sick or not, and spread of safe blues in the same way. And notice that some individuals are holding their cellular device, i.e. they're playing the game of safe blues, and many are not. Okay. And so the spread is just standard, in this case, discrete time SIR spread. Okay. So that's model 1. But by kind of creating this, there's a coupling between the spread of COVID and the spread of safe blues, because with, say, the green individual that invited these other individuals, she might spread COVID if she has it, and might spread safe blue strands if she has them only with the people that she's invited. All right, model 2 is a slightly different model. So model 2 has the notion of location, discrete location. So there's a complete binary tree, as you see. In this case, there are 8 leaves in the tree, so the tree is of depth 3, okay? And the leaves, which you see on the left, are the homes of individuals. And individuals migrate between their homes where they live by themselves, or and they migrate east to the right towards the root. Okay, so when they migrate all the way to the right, then everybody's at the roots, like everybody at the community center. If they've only moved 1 node from their home to the right, then they only see their next door neighbor, etc., etc. If they move twice to the right, they can see up to 4 people. So this is a continuous time Markov chain where individuals migrate independently according to what's called birth-death processes. The details are not so important. At each point in migration, they follow stochastic SIR dynamics according to the general epidemic model. Okay, so social mobility, social interaction is based on who they're with, if they're at the nodes or they're at the root. If you go to model 3, Sharat's model, so here individuals live in Euclidean space, in 2-dimensional space. They move according to biased random walks, where the bias is chosen by tilting the random walk, like choosing the angle based on von Mises distributions. And they're biased either to their homes, so they're either kind of walking around their homes, or biased to the shopping centers. And they teleport between home and the shopping center. In shopping center, you kind of get, you've got plenty of homes, but only 2 or 3 shopping centers. So you've got many more potentially in the shopping centers. So in each of these models, and then again, individuals spread COVID or safe blues when other individuals are within a physical radius around them. So in each of these models, you have kind of the ability also to turn on social distancing or to affect social distancing. So in model 1, what you do is you just limit the number of individuals that an individual sees. You do that by changing the mean of the truncated Poisson distribution of the number of individuals that an individual meets. In model 2, you take the birth-death processes of individuals between the leaves and the root, and you make it that the birth-death process pull you more to the leaves. Okay, so individuals are in general more at home. And in model 3, you limit the radius of motion of individuals, and importantly, you kind of lock down and you don't let them spend too much time in the shopping centers. Okay, so very different realities. None of them tries to be exactly a situation that's real, but in all of them we can couple the COVID trajectory and a safe and multiple safe blue trajectories, and these are kind of the results. You've already seen the bottom one. That's the one I presented the previous results on. So in all of them, there's a period at first, and in the paper, you'll see, if you look at the paper, you'll see kind of the exact parameters of what we do with social distancing. So in model 1, in Marine's model, you've got a lot of safe blue strands. I think this was a simulation of 100,000 individuals. It's quite easy to quickly simulate many individuals in that model. And you've got that prediction from day 215 or so when social distancing was about to be turned off. Model 2 was quite hard to simulate, probably because I coded it. It wasn't very efficient coding. There's only 5 strands running in this model, or maybe 10. And you see that the prediction isn't great, but you still get, even with 10 strands and a quite noisy model, you get quite a good prediction, or at least a solid enough prediction. So you see that blue line in model 2 from day 150 onwards. And model 3 is the one that you saw. That's the Euclidean movement model. Okay, now what we did in each of these cases is we used the same neural network architecture, which is a way of predicting or finding the relationship between the input safe blue strands and the output, the COVID trajectory. We use both the number of susceptible and infected, both for strands and for COVID. And we do training up to a given time, and then we do testing. That's what's done. So what you see on the left-hand side to the left of the black training line in each of these is kind of the fit on the training data. Okay, with average square loss and 10 H activation functions. And in a sense, after trying a few variants, this is in a sense a rather straightforward machine learning exercise. Okay, we probably didn't do the best that we can on this. Of course, you don't want to do the best on one specific model, because then you'll be overfitting. But the important thing is that the method was designed on the data of model 1, and then it ran very well with the same method on model 2 and model 3. I mean, in contrast to other machine learning problems where one will be presented with a whole bunch of kind of training data and can do a whole bunch of things, COVID-19 is hopefully happening only once for us. And then comes the second thing, understanding the effect of various social distancing regimes on R0. So here we did something a bit more sophisticated. So what you see on the left-hand side is kind of SIR dynamics, okay? And Zoltan presented this here a few weeks ago with his extension, which related to something else. But you've got the SIR dynamics. So you've got the S, the I, and the R, but you've also got the S tilde, the I tilde, and the R tilde. And these are the dynamics of COVID, of safe blues. Okay, so the SIR is COVID and S tilde I tilde R tilde R COVID. So you couple both of these ODEs with beta of P and gamma of P, which is the infection and recovery rates, as a function of your social distancing parameter. Okay, and you do actually know the social distancing parameter. I didn't put them in this presentation, but you have them in the appendices for the paper, because government knows what it did. It doesn't know it in a quantitative way, but these are kind of categorical variables where you had high level, medium level, low level, etc. Or maybe they can quantify it according to some scale. And the idea here is to couple the COVID and the safe blues based on these constants, delta and delta gamma. Okay, so then we try to couple the ODEs for COVID and safe blues. For safe blues, we worked on the mean safe blues, and for this we also used a method that's really developed by the co-author Chris Rakaukas from MIT, which is all about the universal ODE. So beta of P being the kind of the lockdown parameter, is trained using a neural network. Okay, so you're looking at the trajectories and training using a neural network. So let's look, for example, at the results, and I'll just present here model 1, which you see above. So what you see on the right-hand side is some predicted, you're now at time 125 or something like that. And you have given the social distance strength, which would be nominal to the specific country you've been dealing with, etc. You have a prediction for what R effective of T is at that given time. So you're now at time 125, and you kind of have that curve. And given that curve, then you can go to the left and you could say, well, if I'm doing high, medium, or low, well, this is where I would be taking the COVID trajectory to be. The low would be kind of the low social distancing, highest growth. Highest would be killing it completely, but with other costs, etc. So this method probably has to be refined, but we believe there's kind of a lot of value in that, especially if kind of learning how to work with these safe blue type signals more and towards the end game of COVID-19 to be able to do things. So that's where I wanted to finish. I want to finish at 8:30. It's 8:47. That's it.
Okay, thanks, Yoni, for such an interesting and innovative talk. So maybe if I count down, we can all do the usual hand clap. So 3, 2, 1.
That's rewarding. Thank you.
Yeah, it's nice. I like it. So does anyone have any questions they'd like to start with? I have a question. So I have a couple. Oh, yeah. So am I jumping in front of everyone? So maybe my question kind of comes down to the last part that you spoke about, this dynamic deep safe blue part of the paper. And I was just wondering, it's kind of a general question, how did you come up with the idea of using or of training a universal differential equation? Because this idea, although it builds on ideas that aren't so novel, this actual implementation is more of a, from what I understand, it's more of a kind of novel implementation. I was wondering if something led you to choose this path, or?
Yeah, okay, thanks. So, I mean, if we look at kind of what happened here, I mean, so for those who know the people, most of us are applied probabilists, which is, I should say a modern form of a statistician, just to poke the few statisticians around. And then we realized, well, I mean, this is clearly a machine learning problem. And we knew of Chris Rakaukas from MIT, so he joined a bit later, and then Raj Dandekar is a graduate student at MIT, right? And we just knew Chris for these nice methods of actually fitting ODEs using machine learning methods, but in a way that's kind of a hybrid between a black box system and a a complete specified model. So the general philosophy is, that you're dealing with SIR type dynamics. So you know that you have a product of S and I. The law of mass action is there. how do you throw in a neural network that will then kind of do a good model fit and give you good fit for the data? So it just felt natural for this problem.
Yeah, I think it's a good choice.
Yeah, thanks. And I mean, and, you know, it seemed like, and yeah, it was clearly, you know, it's clearly Chris's cup of tea. Now, this thing that we have here, yeah, you can still see this, right?
Yeah.
I mean, it's still really early days. And the reason that it's early days is if we don't really have any uncertainty bounds on, you know, what is the variability of the safe blue strands and how we behave when the number of strands grows. And it might stay early days forever, even if this is implemented in one or several countries. Then, you know, by the time that kind of data is collected, it might be a bit too late. So it might be that the methods only need to be refined for the next epidemic. But the thing is that if we look at all the other models that are being used and presented to to government, they're just as noisy, if not more, because they kind of rely on parameter estimates that have so many assumptions. Here we're at least looking at the concrete data, and we have, I mean, this relationship here is a very sensible relationship. You know, it's just you take safe blues and you take COVID, and they're coupled in a certain way.
And how did you come up with the value for C?
So that was a bit arbitrary. And that's probably right. So what you're asking is probably this thing. Okay, so this is, oh, you can't see it. I'm showing my paper, but you cannot see the paper. Okay, so C, which is like 4 times 10 to the minus 5. You cannot see the paper, I assume, right?
Oh, yeah. We can't.
Yeah, so, you know, the value for C is not, this is in a sense tuned to what's happening there. The good news is, and, you know, so it's a bit of cheating. Okay, I can say many words, but it's a bit of cheating. But it just puts it on a solid nominal scale.
I think that's another question, Yoni.
Yeah, go ahead. Thanks.
Fabio.
Yeah, hi Yoni, it's Fabio.
Hi Fabio.
Yeah, very nice idea. I have a couple of questions. One is, so it seems that one of the main or a very prominent way of transmission is not really through direct contact, but indirectly by touching an object or something, and then someone goes and touches again. So I was wondering if this can bias, and if there is some way to keep that into account, if maybe, you know, if using some other method like the cell phone network or some other system to infect instead of infective people leaving a virus in a virtual location, like there is one could take that into account. And then maybe I'll shoot the other question right away. Can there be a bias by the fact that people might not take the phone with themselves? Like if people share some large office and then they use a common bathroom, maybe they will not take the phone to the bathroom, but that's actually a place that will interact a lot. And I mean, interact in the sense, again, touch surfaces and be in contact with each other. And that's maybe a spread contact point. So I was wondering if, yeah, these are possible bias to the model.
Yeah, so yeah, I mean, both of them are situations where safe blues that you see here on the right does not behave like COVID, right? So the first situation that you mentioned is the fact that, you know, a virus is left in some place and then people come to it later. I think within the myriad of solutions that are coming out there, and there are many solutions, some of the GPS-based ones, you don't just do contact tracing, but where you actually touch people Bluetooth, but you actually leave this trace of slime, right? So imagine that I'm leaving a trace of slime and then it's recorded. But that's hard from many perspectives, you know, implementation and privacy and yada yada. So we just treated this, that's just kind of an imperfection of the fact that your right hand thing is not your left hand thing, but it doesn't have to be exactly. The important thing is at least for if you have enough stuff happening in the system, so we believe is that, you know, you just want that the contact on the right hand side is reflected with the contact on the left hand side, and then the statistics and machine learning will take care of removing that bias. Similarly with the office situation, it's in a sense the same story, and the story continues. I mean, kids don't carry cellular phones, elderly people that are, you know, in a sense very, you know, they're suffering most. they don't carry cellular phones.
So maybe I was thinking specifically of people that do have a phone and they have the Safe Blue app, but maybe they just leave it at home or leave it in the office when they go around and meet people because they forget or they just don't take it with them.
Yeah, the only solution we have is to say that this would be one of the reasons why one of these strands will be very different from the actual COVID. But still, if you add that bias and then, the people still have the phone, but now there's less social distancing or more social distancing, etc., then the statistics can ideally correct for that. But we don't have a better answer.
Thank you.
Sure.
Can I ask a question? I think it's very clever, but I might have missed something in all of this, because I'm thinking to myself, how much extra are you getting out of having the Bluetooth contact act like a virus compared to just having a list of the number of interactions each day and not actually bothering to put a model on top of that as if it was a virus. So this, just by people having it, you can download the number of contacts each day. It doesn't have to be a virus, but it still would still give you a lot of the information, or have I missed something?
No, I mean, thanks, David. I mean, that's a very, very valid question. It was actually raised by Tom Stace, Professor Tom Stace. I'm not sure he's here. So after he saw the paper, he suggested something, not Safe Blue, there's just called Contact Blue or something like that, where just count contacts, right? And don't spread a virus, just count contacts. And use that as the first level of kind of understanding social connection. I believe, and this is just based on belief because we didn't test it, not even on the mock models that we have. So I believe that counting contacts will not give as much information as actually simulating an epidemic on mobility. But I believe that it's infinitely more than what we're doing now. So in a sense, yeah, if you can't do anything else and you can count contacts, that's a good thing. It's in a sense a research question or an empirical research question, because everything here is pretty much empirical. How much weaker, if it is weaker than your method of counting contacts is, than actually simulating an epidemic. Hope that helped.
And there was a question from Tim.
Hi, yeah, I had a question. Thanks very much. It's a really great idea. I really like it. So my question was more of a technical one about Bluetooth, I guess. So I heard Bill Gates being interviewed recently, and he said he wasn't a great believer in the contact tracing apps because Bluetooth is too long range and it couldn't distinguish between these within 1.5 meters versus outside of 1.5 meters. Is that an issue here as well? And is that accurate? So, because you can imagine a social distancing, everyone staying more than 1.5 meters apart. Would the app be able to pick that up?
Yeah, great. So, I mean, thanks for the question. So so Marijn and me were sent, Marijn here on this conversation, one of the co-authors, were sent something by Richard Boucherie, one of our Dutch collaborators, a paper from the Bluetooth inventor. I don't remember his name at this time. The Bluetooth inventor is Dutch, obviously. And, the Bluetooth inventor said, hey, come on, I mean, Bluetooth cannot do this, right? So, because there's high variability. But that actually increases the case for a Safe Blues type solution. I mean, Safe Blues is a solution to a different problem. It's a problem of estimation. It's not a problem of finding specific people. But the fact that Bluetooth is noisy means that you could still use Bluetooth for something like this, for understanding the general behavior of an epidemic, but it's not as useful, or you have more noise when you deal with contact tracing. And time will tell. With respect to contact tracing, it's interesting. I mean, we'll see. We heard David Cole's talk last week about contact, about kind of killing the epidemic and what's happening. We'll see when there's only dozens of cases, will contact tracing apps be useful? Because, there'll be so many false positives and also false negatives because people don't have the app. So I don't know. But I do believe that makes the case for using Bluetooth for these kind of diagnostic tools stronger.
Thanks. Could I just follow up quickly? So I saw something about Bluetooth, different types of Bluetooth have different ranges. Could you do anything to distinguish the very close versus the people being further away? Or?
Yeah, no, so, okay, so I'm actually not an expert on the protocol, so the strongest person in our team is Apli on that. But if you look at the, this, what you're doing here is when you measure Bluetooth, you measure RSSI, which is in a sense signal strength, and you extrapolate from that the range. Ideally, you do know if the sender is an iOS or an Android or even the type of phone, because you can even use that to get a better range estimate. Our protocol specifies you get a best effort range estimate. Now, if you have errors in this range, it's not the end of the world if the errors are uniform and, if they're kind of consistent, because again, you'll just get a strand that doesn't behave exactly like you wanted. So there's a lot of strength, we believe, in not explicitly modeling things, but only finding the relationship between things.
Great, thanks.
Mm-hmm.
Are there any more final questions?
Yeah, so I would think that some places, maybe China, perhaps South Korea, have a lot of this information to do this kind of safe blues already, just in their ordinary surveillance. Do you know if those governments are actually interested in this kind of thing?
Is that Ian, is it?
Yes, it was.
Okay, I just didn't see. Okay, yeah. So first of all, I don't know. We did look at network proximity tracing and kind of to see, if that would be an alternative. So say that the government doesn't care at all for privacy. Okay, as it might be the case in, I don't know about South Korea, but maybe in China. So say that privacy is certainly not the key concern. Could you actually know and simulate a safe blues type thing, or just a virtual epidemic type thing based on location? So I believe that network triangulation gives you information only with accuracy at best, which is up to kind of dozens of meters. So you get a whole bunch of noise there, especially when you get to kind of, built up cities with a lot of high rises, etc. Similarly, if everybody would report their GPS location, there's still perhaps too much error there. And also the computational complexity is big. But it's interesting to know because a lot of the groups that we're speaking with, and we're speaking with people in quite a lot of countries, and each group is kind of trying to do different things. So the natural thing is to get network data, even if it's aggregate, and then use it for simulations. But to do a micro simulation on the individual, I don't know if it's done in China or elsewhere.
Okay, so are there any more final questions? Would you like one more question, Yoni, or do you like to?
You should.
Oh, okay. I'm the decision maker. Okay,
Yes.
I have a question that I guess you answered during your talk, because you said you estimated you needed between 5 and 10% penetration to get effective results. Is this? I think I heard correctly. So if that's the case, then could you see this type of technology also being beneficial to countries where, so to, I guess, lower income countries where the uptake of mobile phone usage, where the mobile phones are app enabled or enabled for complex operating systems. So would you see this kind of, I guess, technique applicable in those cases as well?
Yeah, I actually don't know. I mean, I must say that the 5 or 10% is kind of, based on our toy models and really a lot of guesswork, right? So it might be 10 to 20%, or it might be 0.5% to 1%. If you're going to a country that has, the thing is with these countries that we should really be thinking about how to help them. And these are countries, where there is a low socioeconomic situation. There's also a very heavy tail in terms of wealth. Right, so you do actually have extremely rich people that are moving.
Yeah.
So that's actually an interesting question. I mean, if you have this kind of dichotomy of two populations, you've got the people that would completely not participate in this, and you've got these other people that do, because they're kind of from a different class. It might be a theoretical exercise to model what's happening, but I don't know.
This kind of
So,
makes it interesting.
but that's a good question to think of. Yeah.
Okay. Are there any more final questions? If not, I think I don't want to take too much of Yoni's time. We might thank the speaker. Yeah. Thank you very much for tonight, Yoni.
All right. Thanks, Michelle. Thanks,
That's
everybody.
all right. Good night.
Bye.
Thanks, everyone.
Ciao.
Thank you.